Navarro, and I'm going to demonstrate about the Leopold's Maneuver. So the Leopold's Maneuver is usually used to diagnose the fetal presentation and position. So for the correct position, the mother lies supine and comfortably positioned with the abdomen bared. Then the maneuvers 1 to 3 are wherein the examiner stands on the side of the bed facing the patient, while on maneuver 4, the examiner stands at the side of the bed facing the feet of the patient. So it may be difficult to perform and interpret if the patient is obese and when there is excessive amniotic fluid volume, and wherein the placenta is anteriorly implanted. So we're gonna do first the first maneuver, which is the fundal grip, wherein it permits the identification of fetal lie and determination of which fetal pole occupies the fundus. We're gonna warm our hands to avoid the tensing of the muscles. So we do the superior surface of the fundus is palpated to determine the consistency, shape, and mobility, and gently palpates the fundus with the fingertip. For the second maneuver, it is called the umbilical grip, wherein we determine the fetal orientation by noting whether the fetal back is directed anteriorly, transversely, or posteriorly. Usually, when there is fetal back, it is hard, resistant structure, and for fetal extremities, there is numerous small, irregular, and mobile parts. So we place the hands on either side of the abdomen, and this maneuver will locate the back of the fetus. So both sides of the uterus are palpated to determine the direction of the fetal back which is facing. So palms are placed on either side of the maternal abdomen, and gentle but deep pressure is placed and exerted. So the third maneuver is called the pollex grip, wherein this step determines the part of the fetus at the inlet and its mobility. It aids in confirmation of fetal presentation. So the thumb and fingers of one hand is grasp the lower part of the maternal abdomen just above the symphysis pubis, and if the presenting part is not engaged, a movable mass will be felt. And if the presenting part is engaged, details will be defined during LM4 or the Leopold Maneuver 4. To do the fourth maneuver, which is the pelvic grip, wherein this step determines the fetal attitude and degree of fetal extension into the pelvis. So first, the position will be, we are facing on the feet of the patient. So this, the fingertips of both hands are positioned into on the either side of the presenting part, and they exert inward pressure and then slide caudal along the axis of pelvic inlet. When the head has descended into the pelvis, the anterior shoulder or the space created by the neck may be differentiated readily from the hard head. I am Navarro, and I'm going to demonstrate about the Fundic Height Measurement, and I'm going to use a tape measure in measuring the Fundic height. So let's assume that I already partly drape the tummy of the mommy. So the Fundic Height Measurement is used to monitor the fetal growth and the amniotic fluid volume. So we measure from the top of the symphysis pubis to the top of the fundus. So for 12 weeks, fundus is just above the pubic bone, and for 36 to 38 weeks, the fundus is usually right up under the sternum.
Good morning, doctors. I am Mantri Veerasanarag, clinical clerk in OB rotation. I'm going to perform a procedure called Speculum Examination. In those, we use some materials. Those I'm going to show you now. Here, first we use gloves and the speculum. Speculum, we have different sizes in this one. We have the plastic speculum, depends on the patient necessity, and we also use gynae cotton tip and overhead lamp. First, we would be inspecting external genitalial and around the surrounding areas. After that, we would be washing our hands first, and the speculum should be positioned such that the end of the vaginal speculum tip in the cervix. After that, wearing the gloves, we need to keep our dominant hand. Preferred both hands or gloves. Lubricant, first we need to lubricate the speculum with the water and soluble lubricant. If not, doing a pap smear or a tap water, doing this tap smear. From here, keep looking at the patient face. Insert the closed speculum following this axis of the vagina and go little downwards. Remind the patient to be relaxed. And after that, apply the pressure on the posterior vaginal wall. Straighten the speculum. Seek the cervix. Then open the speculum. Catch the cervix between the blades of the speculum. After that, we would be visualizing and demonstrating the cervix at the end of the vaginal wall. And I showed you before that the cotton swab. With that, we need to take a swab from the cervix. After inserting speculum, we see cervix here. This here it is color is normally pink, maybe redder area around the OS, known as a cervical eruption, or a triangle blue if the pregnant, and red is the cervix, and the red is the cervicitis. The secretion or a discharge observed, the color is the cervical mucosa if the ovulation or blood if menstruation. Normally if we see presence of a growth of a tumor, usually a cauliflower-like structures, or that is why it's called bleed on touch, indicates the malignancy. Slowly remove the speculum. This is how is done the speculum examination. Thank you, doctors.
Good morning, I am Harshil Mehta. I am going to demonstrate bimanual examination. Bimanual examination is done in order to evaluate the size, shape, consistency and mobility of uterus as well as tenderness of cervix. So for bimanual examination, we need hand gloves and lubrication gel. Ask patient to get supine and with the two knees apart, remove the clothings. Then use the middle and index finger to get to the posterior fornix. Push the cervix upwards and try to palpate the uterus.
Good day, I'm Dr. Renzo Ortega, fourth year medical student, and I'm going to show you how to perform rectovaginal examination. So this examination has three functions. Number one, to palpate the uterus, uterosacral ligament, agnexa and cul-de-sac. Second, to assess for colorectal cancers, clean colorectal cancer in 50 years old women and above. And third, to assess any form of pelvic pathology. So usually we perform this examination after the bimanual examination. We need a new pair of gloves and lubricant. Now as we place the lubricant in the gloves, we don't allow the container to touch it to prevent any form of contamination. Now for the procedure, we slowly reintroduce our index finger in the vagina and middle finger in the rectum. As we perform it, we ask the patient to strain down to allow the anal sphincter to relax. Now afterwards, we apply pressure laterally and anteriorly in the fingers. Now your other hand will be applying a downward pressure in the abdomen, and now you perform your rectovaginal examination. Now remove the fingers and the hand and then wipe the genitalia of the patient or give some tissue to perform it themselves. So that's how you perform your rectovaginal examination.
Good day everyone, I'm Lucy May Magpantay and today I'm going to show you how to do breast examination. So we will be discussing the following. So first of all, the types. There are two types of breast exam. It could be self-breast examination or SBE or the clinical breast examination. So their primary difference is that the self-breast examination is conducted by the patient herself at home. So it could either be in front of a mirror after a shower, and usually it is done monthly 3 to 5 days after the start of the menstruation. While on the other hand, the clinical breast exam is primarily done by doctors in clinics, and it is done every 3 years. You are 20 to 39 years old, and it is done annually by the doctor after 40 years old. So breast exam is not just done to female patients, but also it could be done to male patients as well for cases such as gynecomastia or enlargement of breast. But in this video, I'm going to focus on clinical breast examination of a female patient. Next is material. In this procedure, all we need is a pair of gloves. Most especially know when the patient has a nipple discharge. Also, wearing these gloves help us to protect ourselves, especially because of the ongoing pandemic. Next is position. Later on, I will show you how the patient is positioned in a CBE. Meanwhile, these are the three patterns of palpation that could be done both in SBE and CBE. Important things to consider includes consent, privacy, there must be a closed room or curtain, proper draping, wash hands before and after procedure, introduce name for identification, and instruction. Explain to patient what to expect in the procedure. For example, you're going to touch the patient's breast, and if there's pain or uncomfortable, just tell so. So as you can see, this is our patient before draping and after draping. So always remember to expose just the necessary part to be examined. Breast is located on the anterior thoracic wall. It extends horizontally from the lateral border of the sternum to the mid-axillary line. Vertically, it spans between the second and sixth costal cartilages. It lies superficially to the pectoralis major and serratus anterior muscles. In this procedure, we can only use two techniques, inspection and palpation. For the procedure, instruct first the patient to do the following position, and then inspect for the breast, nipple, and areola. For the palpation, you can just choose one out of the three patterns. For the circular pattern, using our finger pads, we will palpate from the inner going to the outer in a clockwise motion, palpating for any mass. If there are any mass, note for the size, consistency, and in which quadrant it was palpated. So, same way, we will do it on the contralateral side, inner to outer, in a clockwise motion, and then compare both breasts. For the linear pattern, we will start from up, going down. Also on the other side, from up, for the wedge pattern, basically it's just dividing the breast into quadrants. So we will also start from outer to inner, like this. Also do it on the other side. And then regardless of which palpation technique you use, the end procedure is to squeeze the nipple for any discharge. After palpating the breast, don't forget to also palpate for the lymph nodes. So lymph nodes to be palpated are supraclavicular or above the clavicles, infraclavicular below the clavicles, and also the axilla. In the axilla, it is divided into anterior, posterior, medial, and lateral. Below is an example on how to document the PE findings of the breast. And here are some of the common diseases of the breast. Thank you for watching our group's video. Hope we were able to impart something. Stay safe. God bless.